We are. Sole decision. You all have plantar fasciitis. And you only have $500 to spend on your treatment. You have option 1, prefabricated orthotics for $40, night splits for $100, or custom orthotics for $500, blowing all your money. Your job is to make the best educated decision you can. Where will you put your money? That is the question.
I'm all in, Matt. I'm all in.
Here are the objectives. By the end of this video, you should be able to identify the risk factors and causes for plantar fasciitis and differentiate between the two. Name the 2 outcome measures that are most often improved in plantar fasciitis with orthotic treatment. Compare and contrast custom orthotics, prefabricated orthotics, and night splints in terms of their efficacy for treatment of plantar fasciitis. You will now be introduced to 3 clinical populations that commonly present with plantar fasciitis. Meet Cam. Cam is in his 40s and has recently taken up running just in the last 2 weeks. He has gone from not running at all to running 30 kilometers per week. As you can tell, Cam is excited about his new exercise regime. Cam uses an old pair of runners with worn-out soles. He often runs on hard surfaces and has poor running biomechanics due to a pes planus foot stance. Meet Curtis. Curtis has recently turned 50 years old and works as a nurse. As a nurse, Curtis spends most of the day on his feet. Last year, Curtis got a pedometer for Christmas and found that he was taking over 9,000 steps each day. Meet Casey. Casey is retired and is just enjoying his 60s. He likes to lead an inactive lifestyle and henceforth spends most of his days watching TV. Casey aspires to watch every movie on Netflix before his 70th birthday. Casey's wife used to complain about how he was gaining weight since retiring, but she recently passed away, so Casey can do whatever he wants.
Hi, so what seems to be the problem?
What's that? I have it here. I can't hear.
What seems to be the problem?
Oh, every time I wake up, I have this pain on the bottom of my foot.
Oh, I find myself walking on my toes to avoid putting weight in my heels.
Well, I'm not having pain during exercise, but after about 30 minutes when I'm done, I'm starting to have pain in my heel area.
Alright, so I have your ultrasound. And yep, it confirms our suspicions that you have plantar fasciitis. Plantar fasciitis is usually caused by micro tears and loading at the origin of your plantar fascia. The initial treatment protocol for plantar fasciitis is stretching, holding the stretch for 10 seconds for 10 reps 3 times a day, avoiding barefoot and flat shoes, home icing, and limiting activities.
However, at the 6-week follow-up with the doctor, these treatments did not result in any significant improvement for any of the patients. During the follow-up appointment with each patient, the doctor gave 3 treatment options based on the best evidence available that have been shown to improve the outcome measures of pain and function.
Unavoidable, simple, irresistible, and certainly you're kissable. But next to you, I'm way too shy and lose my backbone. Leave my feelings unknown. Play should've, could've on my own. And I'm left to.
Alright, so how did you find the treatment?
The prefabricated orthotics, they reduce pain a bit.
Well, the custom orthotics I think definitely reduce the pain, but they're really expensive.
Oh, darling, those old things, they were so uncomfortable. I had to take them off on the first night, and I've never worn them since. And now my feet still hurt.
There is some evidence of improvement in pain and function with the use of prefabricated and custom orthotics for plantar fasciitis. But there is limited evidence that each treatment type results in a greater relative degree of improvement, even relative to no orthotics at all. In addition, the compliance to the night splint treatment is so low that it is practically ineffective. Since the cost of custom orthotics was far greater than that of prefabricated orthotics, and both show similar efficacy, perhaps the prefabricated orthotics would be a wiser choice at this time.
Now that you've seen the 3 treatment options for plantar fasciitis, I ask you again, where would you put your money?
In summary, the risk factors for plantar fasciitis include poor foot biomechanics, being overweight, prolonged standing, a tight Achilles tendon, or inappropriate footwear, while the actual cause of the pain is chronic excessive loading at the calcaneal fascial enthesis. Studies assess the efficacy of prefabricated orthotics, custom orthotics, and night splints using the outcome measures of pain and function. In those studies, there is limited evidence for these treatments for their efficacy in improving pain and function, or whether one treatment option is more superior.